between NSSO and all the hospital, especially private hospital that recently have a lot of complaint that hospital charge patient very much.
Exactly.
And after we negotiate with the hospital, all of them return money to
return them.
Yep.
Oh, that's
and they
great news.
we charge to NSSO instead.
I'm Kusmai, your Tasmut, your host. Welcome to Thailand Today program. The government has reiterated that no COVID-infected Thais should be charged for being treated at state or private hospitals. Additionally, the National Health Security Office has announced that COVID-19 vaccine recipients experiencing adverse effects are entitled to receive compensation. Nevertheless, confusion remains over which party is responsible for COVID-19 treatment fees, who needs to advance the money, and how will they get reimbursed. To find out more, today we speak to Dr. Today2021 Ari. He's the Secretary General of the National Health Security Office, NHSO, on these hot issues. Sawadee. It's hotter than summer month, isn't it?
Especially for the topic of who pay for COVID-19.
Who pay that?
Yes.
Now, sir, we're going to separate into two things. The first is treatment.
Yep.
So we definitely, all Thais get free of charge, even if you are in the state or you are in the private sector.
Yep.
The secondly is if you get vaccinated, you get into trouble, then you'll be paid, right?
Yep.
So these two things. Now let us maybe you can touch a little bit on this free charge after a diagnosis and treatment and all that kind
yes,
of thing.
Any Thai people that suspect that you will get the COVID, you can go to any hospital, both private or public hospital, to get the screening test for COVID-19. And it's free of charge. Because
screening means you don't know whether you get it or not, but you want to know. That's one thing. Okay, yes sir.
Normally if you suspect, because maybe you go out and you not prevent yourself enough, and you talk to people that you know after that they get a COVID. So this means that you are the suspect people.
Okay.
So you can get the service for screening.
First stage.
Yep.
Okay.
And after you got the screening,
yes sir,
and you have a positive COVID, you can go to any hospital, both public and private also. And all the treatment cost, government will pay by NSSO. Will pay for screening and treatment. And if you are under the Civil Servant Medical Benefit Scheme or Social Security Scheme, NSSO will collect the expense to pay for the hospital. This is the system that we designed for COVID-19 in Thailand.
When did it happen?
In March 19. Last year in March.
Not that we can treat it and then go back home, the bill come after you.
Actually, no.
No such thing?
No.
Are you sure?
Because we have a contract
yes,
between NSSO and all the hospital, especially private hospital that recently have a lot of complaint that hospital charge patient very much.
Exactly.
And after we negotiate with the hospital, all of them return money to
return them. Yep. Oh, that's
and
great news.
We charge to NSSO instead. Because we contact them already.
Okay.
But maybe they have misunderstood something.
Okay.
And sometimes they complain that when they reimburse from National Health Security Office, maybe we pay them too late. So they want to charge from the patient first, and after they got the money reimbursed from the NSO, they will return back to the patient. So now we change our system to pay them back earlier, faster, from more than 1 month to only 2 weeks. So all hospitals accept this new regulation. So at this moment, I believe that no hospital will charge patient from this reason.
So at least the audience can be peace of mind for this kind of, the first stage done. Now second one, sir.
For the vaccination, because in the near future, government want all Thai people got the vaccine. And we know that this vaccine is under experiment summit because it's not full research.
Not skill, yes.
So we know that sometimes some people may get side effect.
Side effect, yes.
So the government prepare some money that if you get the side effect related to COVID, you can apply for reimburse for this kind of thing.
Yeah.
So this is the objective for this is the government try to make sure that all Thai people should get the vaccine. If you had any injury from vaccine, government will be responsible for this kind of thing.
Okay, sir. Doctor, before this is about approximately 1 million. And there will be maybe 10, 20 out of the millions got affected already, like blood clotting or whatever. So these are the people to get the money back?
Yes, correct.
Will they?
Yes,
oh,
correct.
Interesting. Yeah.
But actually the side effect is very, very small. But
some people...
yes, but the news try to focus for this.
Yes, sir.
So we think that maybe if we can have some money to guarantee that if you got any injury, we can pay you for this side effect. It can make sure that you can happy to get the vaccine.
Yeah. So at least peace of mind. But this is new.
This is new.
We didn't know this before.
Our board just passed this resolution last week.
But the Thai normally bureaucratic procedure. And we're now just knowing about this, and is something happening? It takes time.
We know that our Thai system maybe use longer time to reimburse. So now we try to set the subcommittee in all 13 regions around the country. And we can guarantee that we will pay this money only for around 5 days.
5 days, not 5 months.
After we got the document from the patient. And you can submit your document or complain to the hospital that you got the vaccine. Or you can go to the provincial health office or go to regional branch of NHSO all the country.
Yes, sir. How much reimbursement?
For the injury, it's not more than 100,000 baht.
For injury?
Yes.
How injured? How much injury?
Injury may be...
painful?
No, painful. But injury means that you may injury and cannot go to work someday or something like that. But only a little bit fever
you get
or got some paracetamol and improve it, maybe not mean bad injury.
Can we count in the days, period of time? Suppose how much you get 100,000 for
actually,
for 1 week?
It depends on the subcommittee. And we need to decentralize or allow the doctor in the area to make a decision. So we cannot have a clear cut that how many days, how many symptoms. It depends. Maybe a doctor think that even this is 2 days, but it's okay, then we will pay.
This is scary.
Yes.
You can never know because it's under the decision of or diagnosis of the doctor. So what?
Yes.
The doctor said, no, but I'm paying, I cannot work.
That is the process that a doctor will use their knowledge and
justify.
We cannot have a clear cut, but it depends on the situation in that area as well. Yes.
But Mr. Secretary General, you are the one who's talking today, and you're not getting cut, then there will be another trouble for the people.
Actually, we have some guideline, but
okay.
It's not related to vaccine. But I think those guidelines can guide the subcommittee to make a decision that how injury or how long the day that people have to get sick or relate to vaccine.
Can we take a quick break and we're going to come back after the 100,000 baht, right? Let's take a quick break and we'll be back with more of Thailand today. Don't go away.
Thai people have made it through the COVID-19 crisis because we all stayed home for the greater good to stop the spread. However, the global economy is on the decline. Thailand is no different. All sectors need to work together to accelerate our recovery. The government sector will reduce taxes, lower interest rates, and promote the business sector. As for the people, we will have to adapt to the new normal. This means working from home, studying online, finding new means of income, and staying safe. It's only if we can all stay healthy that we'll have the power to move the nation and balance our economy once again.
Welcome back. You are watching Thailand Today. We continue our discussion with Dr. Thambrat Ari, Secretary General of NHSO on compensation for COVID-19 related treatment. Yes, sir. We did talk about reimbursement for the first stage, 100,000 baht for injury. And then, sir, second
is if the condition related to vaccine cause patient to be a disability, we will pay not more than 240,000 baht. And if maybe very, very unlucky, that may be related to death or permanent damage, we will pay not more than 400,000 baht. But as I told you that we try to set some subcommittee all the region. Maybe they make different decision in different region. So patient can appeal if you think that it's not fair enough for you, that you should get the money or something like that. Because this is this is vaccines is new. We cannot have clear cut that which level of injury or how to classify or something like that. So we are maybe some part we allow the subcommittee to make decision by themselves first.
Well, the government and also the ministry or try best just to persuade people to come and inject. This is good for the country actually as a whole, but things could be slowly to do things. But this is materialized already, right? Materialized now. I see. So people can now go and they get into trouble and all that, get into side effect?
Actually, this regulation we back to the end of February. At that time that we first inject the vaccine in Thailand. So if you have a problem from that time, you can apply for this money as well.
So far, from February, for anybody already reimbursed?
At this moment, no one reimbursed yet. But I think maybe we just broadcast this news to all the country and we just set the system. So I think maybe next week or
hope not.
But we hope that no one have an injury from vaccine.
I know. That means so far so good.
Yeah,
there's no such thing happening. So in case someone experience sudden side effect from COVID-19 vaccination, they are able to go to the nearest hospital. Do they need to go to the hospital which is registered?
Actually, the condition related to vaccine or COVID, it is an emergency condition. So you can go any hospital near you. Maybe sometime you are reside in Bangkok, but you go to Chiang Mai. And after you inject the vaccine or something that relate to COVID, you get something injury or get sick, you can go any hospital there. Because COVID is an emergency disease, so you can go anywhere.
You see, some hospital has return or what, I don't know, but Social Security, they do not accept anymore. I mean, they used to, people can come for that. But then, I don't want to mention the hospital, which is nearby my house, and then they give up already, no more with Social Security. In this case, something happening, can we just go to this
If
hospital?
you have this condition, you can complain to our call center. Yes,
1330.
24 hours, 7 days a week. So you can complain anything.
Somebody will pick up the phone.
Yep.
Right.
Even some hospital charge for your COVID, or maybe you cannot get the access for the screening or treatment. You can complain to our call center.
Interesting. According to data for Thailand, what have been the most serious side effect and should people be concerned about?
For the vaccine, right?
Vaccines.
Actually, we think that maybe it's a mild injury or mild condition. Because from the statistic, at this moment, we have no data that vaccine relate to death case, death case in Thailand. So we think that our money should pay only for mild injury or some just a little condition.
Why do you think people are so scared of? Why they're not coming up? Because in Thailand, there's no such severe consequences.
Yes, but because the news try to say that someone got a stroke, someone got any condition that may make people scared for this. So we try to make sure that compared to benefit of vaccine, it should be you should get the vaccine instead of a scare for side effect. Yep.
So vaccine is a vaccines. Any type, any brand, all the same.
Yep.
Whatever. I don't know. We have to check from the doctor. Doctor, it's been a hot topic in the news. Some COVID-19 patients have complained on the social media, this is what we are talking about, that the hefty hospital bill, as high as 1 million.
Yep.
So how could you encourage them not to do so, and then how the people actually control once again, sir, because this is something we should worried about.
I would like to make sure for all people that all the expense for COVID-19, from the screening to treatment, all free for Thai people. If you got any charge from the hospital, you can complain to our office. Sometimes hospital may misunderstood about the system that reimburse from NSSO. So they want to get money from the patient first. So this condition we negotiate with all hospitals already. No need for do that. And sometimes hospitals said that they have to provide more medicine that is not included in the list that they can reimburse to NSSO. So now we negotiate to all hospitals that if you have those conditions, please let us know so we can propose to the cabinet to expand this for no need to charge for the patient.
Not at all, not a single star.
Not single star. And sometimes hospital charge more than we negotiate price. So
yes,
that people can complain to us, and we will negotiate to the hospital to return this money to the patient. And from these 2 months, we have around 192 cases to complain to us. All of these that we negotiate, they return money back to the patient.
And the money reimbursed back directly to them or to the hospital, or what is the process?
The hospital will return the money to the patient, and the hospital will reimburse to us instead. Yes.
So this is the process at the moment. Just go in with ID card.
Yep. Only that.
Only that. Enough.
Yes.
And then you can buy, go.
Yep.
Right?
So we hope that after this, after we negotiate with all hospital, this complaint that people have been charged will be
You
no
sure?
more.
Because
Yep.
there's a big hospital, a rich hospital, they will
Yes,
also
yes.
accept this?
Yep.
Oh. On average, what is the cost of COVID-19 treatment?
It depends on
per
the
patient?
severity of the cases. So we differentiate as a green, yellow, and red. And red level is very severe. We used to pay for 1 million baht per case.
That means the people who turn back,
Yes,
those,
yes. But in average, it's around 100,000 baht per case. Because in the green color,
Green
people can walk, people can do anything, but just have a COVID-19 in the
That
body.
much, 100,000?
100,000. Because the most of the expenditure is because we have to pay for prevention for the nurse or doctor. That's cost very, very, very much. Yes, it's not medicine, it's not food, it's not room. Yes.
Oh, it's great to know. We didn't know that. We thought it's just ourselves, but why so
Yep.
much, But this just have to be for,
Yeah, we have to
for
prevent
other medical
provide-
personnel.
Yes, yes.
So, how does insurance come into play, especially with many people have already brought
Yeah.
COVID-19 insurance?
If you have your personal insurance, by our regulation, we will charge your private insurance first.
Yes.
But after that, you will charge to us. So this is the system that we set. But all the charge will not have more additional charge from you, from the patient. Yep.
Very interesting. And this is a universal coverage fund?
That is the
scheme?
basic,
That's
the
scheme.
basic principle of universal health coverage.
It is a
that
universal.
all people should not pay, and all people should not worry about the money to prevent them from access the necessary service. So this is the principle of UHC in Thailand. Yep.
Good, because they're already worried about their health condition. They have to pay the in the pocket also,
Yep.
that. Very interesting, doctor, and thank you so much.
Thank you.
It's very
Thank
clear
you.
today.
Thank you very
and
much.
I do hope that people were very happy to get vaccinated. And please do come back and tell us more about this.
Thank you.
I'm
Yes.
going to ask you about how many number of people who were
Okay,
affected.
next time.
Right.
Yes.
Thank you. Unfortunately, we have run out of time. Thank you so much, Dr. Jadet Thamarat Ari, Secretary General of NHSO, for clarifying who is entitled to COVID-19 related treatment compensation, whether in terms of experiencing adverse impacts from the getting vaccinated or from the COVID-19 hospital bills. So that's all the time we have for today's episode. We broadcast every Tuesday to Friday at 9 p.m. on NBT World and live on YouTube. I'm Kusuma Yotha Smut. สวัสดีค่ะ